Hi, it's Jeff Katz from News Radio 1140 WRVA. I've been so excited about the fact that I can tell you about Dignitas Health and Dr. Jill Zackerson. I've been telling folks about it for a little bit now, but I was so excited about it. I wanted you to hear from Dr. Z, as we like to call her, and get the real full story. So, Dr. Z, thanks for having me.
Thank you, Jeff. Thanks for being here.
All right, so I tried to give people a sense of who you are and why you created Dignitas Health, but nothing better than you telling your own story.
Yeah, well,
so tell us.
This practice, it's a new practice. I've been working for the last 12 months trying to recreate, all the things that I love about medicine, spending time with patients, having the ability to really sit down, get to know my patients, and have a relationship. And the things that were interfering most with that was having to work within a framework where insurance can dictate the kind of care, what kind of access, and how much time we can spend together. So I've eliminated that from Dignitas Health, where patients can come for just a membership monthly fee to receive the care that they need, regardless of how often they need to come see me.
Well, let's talk a little bit about that, because I shared with you my primary care physician was so frustrated with the insurance system, he moved to Canada. He thought that was a better place to practice medicine. Yes, I mean, unbelievable change. But you decided it's all about the patients, not about that insurance code.
Right. I decided to stay put.
Right.
Just change things a little bit. So that's why I went to medical school, is to take care of patients and get to know them. As a primary care doctor, I like to look at the whole patient, the whole person, and I decided this model of care called direct primary care really allows me to be the kind of doctor I enjoy being.
Let's talk about direct primary care, because in the insurance model, my doctor could be seeing 5,000 patients, and in the direct care model, you've got a very different number.
We do. So I am making a promise to patients that I'm going to care about you. I'm going to know your name. I'm going to be available to you. And in order to provide that level of care and access, I won't be able to maintain a panel of 5,000 sort of anonymous patients. My practice will be a limited size so that I can maintain the quality of care.
Okay, and let's talk a little bit about fees, because you're taking the insurance company out of it.
Yes.
So how do we pay for these services?
So the only fee the only income that I have as a physician in this practice is directly from the members themselves, and they pay directly for the cost of their care.
Okay.
And so in terms of numbers, the primary care above the age of 20 is paying $60 a month.
Wow.
There's no copay when you come in. If you need to see me twice this week and a couple times next week, it's the same rate. And then for pediatric patients, if they're part of a family the parents are also seeing me, it's just $10 a month.
It's amazing, because you listen to those numbers, that's less than most of us are paying simply as a copay for an office visit.
Right, but I think what makes that work is that it's really me and the patient. I have a small staff, very small overhead, because I don't need to have a large staff to sit here and submit claims to insurance and correct codes, and that's really where the cost gets added, driven up.
Sure.
There's a lot more personnel and time and energy that goes into dealing with the insurance companies themselves.
I think the other thing that people need to know about Dr. Jill Zackerson and Dignitas Health is that it's not just the patient-doctor relationship, it's the fact that right here in this office, you've got access to lab work and a pharmacy, right?
Yeah, so there's a lot in these little four walls. Here in the practice, I have 2 rooms where I can see patients, and then I've squeezed in a small pharmacy where I have the ability to dispense and order wholesale medications, dispense them right here from the practice. And that's really at a wholesale cost. And it's just a way that I can add value, save people money. And same thing with labs. I don't draw blood here. I send folks to a lab facility where my practice is billed directly. Again, it's eliminating a lot of the kind of accessory pathways that add expense to care unnecessarily. And so patients are able to pay a direct, much lower price for labs as part of the benefit of being a direct care member.
Well, I want folks to learn more about it, and I want you to explain Dignitas. What exactly is Dignitas?
So dignitas is Latin for the word dignity. And when I really reflected in starting this practice on what's an important principle for me and what's really my approach, I try and treat every person with the respect and dignity that I think they deserve. And so it speaks to that you know, folks have an inherent dignity and need to be treated as such. And I think this model of care really allows me to do just that.
Absolutely. Well, I've got to tell you, it is a new model of care, but the reality is it strikes a lot of us in exactly the way that medicine used to be. You knew your doctor knew you, they cared about you, and you had access to them. Now, I'm going to urge you to check out the website ChooseDignitas.com. You can see that right behind me, ChooseDignitas.com. Learn more about it, reach out, and I'm sure that Dr. Z would be happy to talk with anybody, right?
Anytime, yeah, absolutely.